Hi everyone, Dr. Timothy Gallagher.
And Dr. Becca Brooks.
We're from Maragal Medical. This week we're going to be talking to Dr. Brooks about her new role in the clinic, and that's doing patient consultations. This is an important step in the process where the patient gets to be educated about their condition and all of the available treatment options that they're going to have here at Maragal Medical. Okay, Dr. Brooks, so this is great. You know, you're an amazing associate here in the practice. You've done such a great job. Your new role is in the patient consultation, or what we call the day 2, is it's a separate patient appointment after the patient has a medical evaluation with Dr. Marciello or our nurse practitioner, Molly Sophis. And this is a process where you kind of go through, you put all that clinical information together, and you get to explain to the patient, you know, what their condition is all about. And you've done such an amazing job, and I can tell you love doing it because you love educating patients about what's going on with it.
I do, yeah. I really kind of geek out on all the clinical aspects of stuff. Like, you know, I love looking at the imaging and, you know, kind of putting everything together, and the team approach that, you know, goes into kind of figuring out what's going on, what's like the best way to handle things, and, you know, trying to get that across to the patient, as well as like sometimes half the battle, like putting things into layman terms is not super easy when you're used to talking in clinical terms. Sure. As well. So getting that across so that it's, you know, digestible anyway, on a level that you're able to make an informed decision is super important as well.
You know, and I have great pride and joy watching you go through this process, because like I go back to the days when I was a solo practitioner, and you know this because we still maintain, you know, both a medical practice and a chiropractic practice. And for me, you know, when I was first practicing, you know, to do a new patient exam, to then, you know, think on the spot, to spend, you know, a few minutes explaining to the patient, you know, what's wrong, and then treating them. It was just too much, you know. I think this model and having the time to really prepare the patient's case, put all the information together, and then organize it in a way to where you can explain to the patient what their problem is, and then all of the available treatment options. Like I know, and I'm sure you have gone through this too, a lot of great satisfaction walking out of consult after, you know, you've done that, because the patient now understands what their problem is, and they're gonna have a step-by-step process on how we're gonna fix it for them.
Yeah, I think the patients really appreciate the extra time taken to explain everything as well, because like you said earlier, like it's, you know, you have 5 minutes to, you know,
maybe 5 minutes.
Yeah, maybe 5 minutes to quickly go over everything, and you know, you don't really get to go in depth and, you know, allow people to ask questions, and, you know, you're not looking at the clock and trying to get in and out of there in your normal treatment time. So and patients have been, you know, pretty appreciative of that, you know, just in my experience in doing this as well.
Yeah, I think the big thing is sometimes it can be very overwhelming because there's a lot of information. We prep them for that. We let them know that there's a lot of information, but then our manager Kelly comes in, she's written everything down, she's taken the time to look at everything that's been recommended, you know, match that up with the patient's health insurance so they know exactly what they have for coverage. And then if something's not covered, you know, she'll let them know what that out-of-pocket expense is so that the patient can actually take that home. There's no rush, there's no pressure to make a decision, but they can look at that and they can say, you know what, I wish I could afford to do everything, but I can't, but I can do this, this, and this. And relaying that to Kelly, and that way there, you know, we know exactly, you know, what the patient is accepted for care. And what we always say too is, no matter what you decide, we're going to take great care of you.
Right, of course.
And that's the bottom line. More information about our practice can be found on the web at maragalmedical.com. More information is also available on our YouTube page. And I know our YouTube page is growing because my kids say, Dad,
you're going viral.
You're going viral. Or what I said, I'm a virus. Yeah. Consider subscribing. Hope everybody has a great day. We'll talk to you soon.